the concept that surgeons seem to be a little bit different to other healthcare practitioners. Not all of them, but typically more in the physician side of things as a medical practitioner, where they are willing to maybe explore and experiment and try things that are within the boundaries of reasonable, but have that sort of slightly different mentality when it comes to what they're doing compared to other practitioners that sometimes are quite conservative. Mm-hmm. One, have you noticed that? And two, if you have, why do you think that surgeons tend to have that nature?
Jack wrote to me to prepare me for some of the questions that may be coming my way before today. And that was one of them. And I found that a really interesting question, which I've been thinking about a bit since you mentioned it. And I think there's a whole variety of answers to that. Partly, it's not universally true. There's no shortage of very conservative surgeons who've learned a method years ago, which they will continue to use until they finish practice.
Yes.
And not change. And they're very happy, and they feel it works well, so why change? So there's plenty of people just like that. But there's also a group who feel a bit dissatisfied with what we do, always feel that there's room for improvement. I think there's always room for improvement. But the hard part is to know what's just catchy and fashionable and what's truly improvement. And so I think that thankfully there's been some change in how those developments take place now. And it's not just a matter of someone comes up with what seems like a good idea and away they go, thankfully. So things have to be tested.
Did it used to be like that?
Oh, yeah. When I started, we made some of our own instruments. A friend of mine is an engineer.
That's cool.
And he would...
That's truly innovative.
This is
true.
You're
like, I want to solve a problem. I'm going to see if I can...
he used to assist me with operations, and someday he'd say, that thing you're using, I reckon I can make something much better than that.
Yeah.
And he would. So a week or two later, he'd arrive with this new instrument that he'd made in his workshop. And we'd sterilise them, and obviously...
You'd hope so.
Yeah. So it wasn't quite just get out of the bag. But it was perfectly acceptable back then to do that. And so I've got a bag full of old instruments that no way known would I open these days. At the time, it was considered perfectly sensible. And in fact, there was a lot of innovation because of that. Whereas now, if you want to do something like that, then you've got to do all this testing that literally costs tens of thousands of dollars for a single instrument. So no one does it because it's way too expensive.
Yeah. Has that changed the process, you think, of seeing innovation and changes within particular surgical procedures since the 90s to now?
Yeah, it does. And obviously it's good about it too, because you just don't want people sort of whipping something up out of the back shed.
About it,
of course.
Sure.
But I'm not quite sure where the happy balance point is, where we're being protective and not doing stupid things, but also not stifling innovation. And I think we've maybe gone too far the other way now, but it's probably better to go too far and be protective than not far enough and have cowboys everywhere. So,
true.
But I think that needs to change a bit, and we come up with some better answers.